everybody. So this is just a quick kind of presentation on how to cover wounds, IVs, PICC lines, things that you normally have to cover for showers. So prior to beginning the session, you're going to check the vitals, you're going to see if it's safe enough to do the shower. You're going to check in with nursing to see if it's appropriate and if they're cleared and if anything needs to be covered. So sometimes the nurse is going to be like, you don't need to cover. The wound nurse is going to come in and they're going to change it anyway, so there's no need to cover it. So just confirm the procedure. And I wrote down the extension of Sandy just in case you need it for, if she says you need to call the wound nurse. Sometimes they don't give you the extension, so 5311, that's her extension.
She's super she's like super helpful and always willing to be. A lot of the time
she'll like time her arrival.
Yeah, like if you tell her what time you need her to be there, she's like, yeah, that works, I'll be there.
Yep. So she's very flexible.
Awesome. She's very flexible. Yeah, always willing to work with you. Half the time the nurses will tell you to cover it, and there's been chances where I just ran into her in the hallway and she'll be like, you don't have to cover that, I'll just come and change it afterwards. So
yep,
she's really
true.
accommodating.
Yeah, so that's a good point. If you want to call her before you even start the shower and just double check with her, because sometimes she does do her rounds even after, so double check with her. Okay. So the next page has the materials that we normally use to cover. I brought in this bag that, it's used for patient belongings and clothing. So sometimes I use that bag, I just didn't include it in the PowerPoint. Is there any other materials that you guys think are used, or other things that you guys typically use for showers?
Are we doing materials or areas to cover?
Materials.
Materials?
Oh.
Okay.
So one time, this is super random, but I was working with someone who used to be a CNA, and she was like, oh, sometimes I use the umbrella bags, which I grabbed some once, and they're not that great, but for some skinny armed people, it actually does help for IVs, but also the specimen bags.
Yeah, the specimen bags, by cutting off the end and kind of if it will fit on their upper arm, I'll use that.
For the PICC line.
Right. But
Okay.
Surgical that looks like the plastic tape.
Yeah, so it's this one right here.
Oh yeah. I find that the paper tape actually stays on the skin easier, like the plastic water's more prone to get
Okay.
underneath.
So sometimes,
use
I don't
paper
know
tape.
if
The
anybody
tape
thinks
itself
that-
gets wet, but
Yeah.
it keeps it down on
Okay.
things.
Yeah, so that's sometimes what I'm concerned about if I use the paper tape, if it's gonna actually go into the wound or the PICC
Yeah, I
line.
think
But
it's just the tape itself gets wet, but it
yeah,
really does
but
adhere
inside
pretty
stays
good.
in. Okay, so
Other
that's
than that's what I use.
yeah, that's another thing that we could use. So the Tegaderm, I put a couple asterisks on there just because the nurses say that it's really expensive, so we just have to be mindful about those things. If we can use a different type of material to cover, then we'll use that before using the Tegaderm. And one thing about the Tegaderm, if you are going to use it, you're going to have to place a gauze or something under it, just because if you use it over whatever PICC line or IV, it's going to stick to the line. So just be mindful of that.
Sometimes I'll tape down a little washcloth too first. As insurance.
Yeah, so you can use gauze or any type of material, just as long as it's not on the skin. Sorry, I did skip areas to cover.
Right.
So those are the typical ones you see: IV lines, PICC lines, dialysis ports, surgical incisions, wounds, bandages, tracheostomies. So today we're going to do a in-service on how to properly cover dialysis port, because I feel like that's the hardest one that we typically see that we have to cover. PICC lines, we can use a bag. We typically just cut and bandage with the tape. The rest are a little tricky. So obviously you're going to be using, your critical thinking skills and try to select the materials that are going to be appropriate for the area, and try to determine what size you're going to need for covering the site. And then you also have to consider if you're going to be covering something that's close to a joint, whether it's gonna be able to move in the shower, because sometimes, I know when I first started, I covered something and it was close to the elbow, and then they bent the elbow, and then you saw the tape kind of start coming off, and you're like, shoot, I have to recover again. So just making sure that they kind of do the movement before you start the shower.
Or like in the folds, if they've got some extra weight here, some of those abdominal things are.
Oh.
I always feel like, if, when in doubt, don't do it.
Yeah, so
No, don't stay
abdominals,
down
they
like this.
just make sure that you check with the nurse sometimes. I mean, those are really tricky to cover because they're basically, showering their whole chest area, and that goes down to like the groin area. So just call Sandy with that, and I'm sure she'll be fine with you getting it wet and covering after you're done. Okay, next PowerPoint is securing the area. So this is just a basic outline of what we would typically do. You just want to make sure that the material is large enough to protect the area. You tightly secure from all sides to create a seal. And then again, trial moving the body part to assure that it stays on when they're showering. And then educate the patient on how to position so that that area doesn't get wet as much as it typically does. So making sure that they don't directly point at the incision. Again, it just kind of depends on what type of patient you have. Sometimes they're not cognitively, they don't have that executive functioning in order to, listen to your directions. So just monitoring that they don't wet it as much as they typically do if they don't have incisions. Okay.
Along with the saran wrap,
Yeah.
at the other facility, they use the press and seal, which looks really nice.
Oh,
Which is
okay.
more costly, but
Yeah.
you could, share it with family members in case they need
Yeah, that's
I would
something
recommend
that-
the press and seal.
Yeah, so once the patient goes home, that's something that they can use, and we can probably suggest at discharge if they're gonna keep covering it. So some precautions, just make sure that it's tightly sealed, there's no water, moisture entering the site. Make sure that if you're using bags that the excess air is pushed out to prevent air pockets. This is especially with the wounds on the foot. I know some people have their patients stand with the bag and some people don't. If you are gonna have them stand with the bag on the wound, then make sure that there isn't any air pockets. I try to cover it with 2 bags, just to make sure that if one bag has a small leak, then the other kind of covers it up. If the patient has a foot wound, assure that they can perform in sitting. So that's something that I kind of talked with Becky. She mostly has her patients sit down during the shower because, yes, there is, it's more likely to open if you have them stand with the bag. But there are times when I've had them stand just because I want them to wash their bottom. The tegaderm I kind of talked about, just make sure that there is something underneath it to prevent it from sticking to whatever line there is. Nursing also stated that if the patient has MRSA, PICC lines, or central lines, just notify them that you are using the Hy-Vee cleanse or the CHG wipes if you're doing a sponge bath. And then make sure that the area is comfortable for the patient and reassess if they need to reposition it. And another thing is sometimes patients are allergic to adhesive tape, so just make sure you go over what allergies they may have. Foley catheter, assure that the bag is above the floor and position where the patient is able to move within limits during the shower. There are some bathrooms that have hooks where you can place the Foley catheter in on the bench, just so that it's safely off the floor. And then make sure that you use the Hy-Vee cleanse in the shower to prevent infections, and always check with nursing to assure that patients are cleared and that the Hy-Vee cleanse can be used.
What's the cleanse you use?
The Hy-Vee cleanse,
The Hy-Vee cleanse?
it's like a blue small bottle like this.
It's pink solution.
Yeah,
That
it's
pink-
like
that
red.
pink solution. Yeah.
Do we have them in the showers now?
They're
It's in the
the
pick,
supply
the supply
closet.
room. I don't, for our For the protocol here, I don't think we have to use it for Foley's.
Yeah.
Not for Foley?
Not for catheters. It's
Oh.
picks and ports.
Oh,
But like
okay.
regular IVs, you don't have to use it for. Foley's, you don't have to use it for. It's just like the pick and the ports they want us to use
I've
it.
used it for Foley catheters just because nursing has told me at times, but
We can confirm with Cheryl Schrade because I know she's the one that has sent out the original email on that.
okay. And then we're gonna complete a skills competency, but we're gonna actually head down to the 3rd floor, where we can practice with a dialysis port on how to like properly bandage it. But any questions or comments? Yeah.
Don't forget that ports always have got to have that green cap over it. You know, if there's no green cap, then.
Well, what I've been finding with ours here is that every time they've had dialysis, the port is actually wrapped with the stuff, so you can't even
Correct.
see if it's there
Yeah,
anyways.
um,
And then if that gets wet, the nurses here won't change it. They have to call the dialysis people, and they're the ones that have to deal with that bandage because I don't know if it's liability
So
or
we need to
whatnot.
do it correctly. So yeah, what's,
Because if it gets wet, then they have to
Yeah, I'm
call.
not talking the dialysis one.
You just mean like the IV lines? Yeah,
IVs and, IVs and something else.
Like the pick.
The PIC lines have got to
Yeah.
have that green in it.
The cover.
I didn't know that, but I got caught by the nurses one time,
Oh,
so.
well, nursing is supposed to put that on once they're done.
Yeah, that would be that would be.
Yeah, that should be on,
Bad
but yeah,
sponsor.
double check
Should
that
be.
that cap is.
So yeah, it should be.
I actually,
Checks and
before I
balances.
left here, they've gotten a lot more, consistent with doing that, but it's just something that's
Checks
really
and
important.
balances.
To
Yeah.
make sure we don't.
Okay. That's a good point. Yeah, so we'll just double check that. And then let's head downstairs and then we'll do individual. To cover a dialysis port, you would use a glove. The majority agreed that this is the easiest to do, so then you would just locate the glove there, make sure that there's no air inside, wrap it around, tie it here. You would use this tape, wrap it around the top so that no water gets in. And something that Becky suggested is that you fold the tape over so that you have a little tab on there to pull after the shower. And then you want to check the chest area and make sure that you have a material that's big enough to cover it. So for the most part, these are big enough to cover the area. Just make sure that if you're using this bag, put this side towards the chest because water can come in here and stay in there and make it heavy. So make sure you turn it around, wrap around the area. If the chest area is too big, make sure you cut both sides, cut through the middle, and then the bag opens up to make it a bigger surface area. Other people also suggested using like the linen bags or the bags where the patient's clothes go. So it just depends on preference, but just make sure that you securely seal it. I would also make sure that you kind of have them move a little to simulate them like washing their hair, just so that the tape, you can see if the tape has moved or if it's come off, then you can secure it again.
okay. And then you had the IV and the pick.
Yeah, so for the pick line, you would cut both of these sides and then bring it up towards the arm and then wrap around the top and the bottom. You would also cover the pick line the same way as we did with the glove. Secure the lines and then wrap around the top and then put the bag over and then cover. Some people use saran wrap too. Just make sure that you cover both the top and the bottom and the sides with the saran wrap. And then with a hand IV, what you would use, preferably if it's closer to the hand, then you would use a glove because that would cover that area, and then you would just tape around the wrist. But if it's higher, if it's more towards the wrist, then what you can use is a glove as well as one of these bags, cut at the top and the bottom, and then bring it in towards the wrist, and then secure the top and the bottom. So essentially it would have both of these on. So it all depends on the area. And again, just make sure that they are able to move it comfortably so that when they do the shower, the tape doesn't come off or it doesn't stick off and the water seeps in.